Hello everyone. Welcome back to my YouTube channel. My name is Jamie Naftali. This channel is about kids welfare, where I create the awareness to mothers, especially on common illnesses affecting children while growing up. I am a pediatrician by profession, so these are some of the conditions that we come through as we see them daily on our daily basis. So that is why I want to make everybody understand. So if you haven't subscribed, please hit on the red button, subscribe to be part of this wonderful family. And if you're that returning subscriber, thank you so much. You are a favorite person and you don't even know it yet. Thank you for keeping tuned always. I'm so grateful. So the video of today, we are continuing on poisoning at homes. Last time we did generally on the poisons the various poisons that we have at home. And like I said, you saw that it is things that we are familiar with in the family and things that we use in our daily basis. So today I want to tackle just one out of the many poisons, one which is kerosene poisoning or paraffin poisoning. This is very common, and it is one of the example of the hydrocarbons. Remember we said the hydrocarbons, so kerosene is one of the hydrocarbons. We said others are things like turpentine. Yes, we have benzene, we have gums. You see the gums that the street children or the street people use. So those ones are also examples of hydrocarbons. So let me begin by doing this kerosene poisoning. Now 10 mils of kerosene is usually very fatal. Fatal means it does a lot of damage. 10 mils, you can imagine, this is the tablespoon. That tablespoon, when it is full, this is what we are saying, it is very fatal. You can imagine. So it is very fatal, and a dose exceeding 1 mil per kg causes CNS depression. So CNS depression is central nervous issues. So the head, we interfere with the brain, that is. So if it is exceeding 1 mils per kg. Now, the lower the viscosity of this kerosene, the more toxic it is. So you can imagine that's how serious it is. Which are the most dangerous ones? Examples, we are saying one is kerosene, yes. Furniture polish, you can imagine the furniture polish, the benzene, those are very dangerous hydrocarbons, poisonings. Now, what are the signs of symptoms of kerosene poisoning? How do these children with kerosene poisoning present? So number one, what the kerosene does, it irritates the mucous membrane. So these are the mucous membrane here. So it irritates the mucous membrane, leading to cough. When it goes, again, we have mucous membrane inside, so it irritates the mucous membrane, causing cough. So the child coughs, then they get choked, especially when they get pneumonias. So they also present with vomiting. This child is going to have continuous vomiting. Other things they present with are bloody tinged diarrhea. So their stool is going to be so loose, and it has got stripes of blood in this diarrhea. Yes, they have respiratory distress. They present with respiratory distress, why you're going to see that these hydrocarbons, mostly the mode of entry is through inhalation or even orals. Like the kerosene, when you inhale it, you are going to get this kerosene poisoning, or you just take it orally. So now with the respiratory distress, mostly it is too much to cause pneumonitis. They cause aspirational pneumonitis, the kerosene. So the children end up having respiratory distress. Respiratory distresses, examples are things like tachycardia. Tachycardia is when the heart rate is so high. Yeah, they have difficulties in breathing, and they also breathe so fast. So this is one of the presentations. So they can present also with fevers, yes, high temperatures. So these are some of the symptoms of this kerosene poisoning. So if it is these street children that use the gum, they have if they have chronic abuse, they cause something we call cerebral atrophy and also renal disease. You can imagine this is how serious this is. So cerebral atrophy, we said now the brain has been affected. If they are addicted to this thing, every time you see them with that gum, so eventually the permanent or the long-term complication is this we are saying now, the cerebral atrophy. Also, they have renal diseases. The kidneys again get infected, and we have issues with the kidneys. So one thing is to note is that all hydrocarbons are usually lipid soluble. Therefore, they reduce the fats in the skin. All of them are lipid soluble, and this gives us even more problems. They also cause local irritations, yes, like we said. So how about if we do the overdosing of this kerosene? How about if a child takes too much of it? Remember we said 10 meals is very, very fatal, and we said 1 meal, if you exceed over 1 meal per kg, this one will cause CNS depression. So what are these long-term complications if they get the overdose? So number one, they're going to get edema. Edema is this swelling. They swell everywhere, the body, the hands, the legs, even everywhere. So because if there's overdose, there's this edema, this swelling. They have hemorrhage. They start bleeding from places, especially the openings. They start bleeding. They have something we call hepatosplenomegaly. This is whereby the liver and the spleen at the same time are enlarged. So they have got this hepatosplenomegaly. They present with it, this hepatosplenomegaly, if there is overdose. So you can imagine how serious it is. They also get things we call proteinuria. Proteinuria is when we have got presence of proteins in urine. So normally a clean urine should not have proteins, but when we have proteins in urine, this interprets with infection of the kidneys, and we say they get renal disease. So proteinuria. They also get hematuria. Hematuria again is blood in the urine. It's also a cause of an overdose of kerosene poisoning. Yes. They also have hypoglycemia. Their blood sugar levels become low. It's very low, and this is more dangerous because when it is low, there's nothing much that can be done to raise it. So if it was up, you can reduce it slowly, but when it is just hypo down, normally we do a little thing to make it come up. So very, very serious. Those are the serious complications or serious signs and symptoms of overdose of kerosene poisoning. How do we treat this kerosene poisoning? Treatment, we start by stabilizing the airway. Remember in our previous episode, we said all poisons we want to prioritize on ABCD. Remember the airway, the breathing and all that. So even with the hydrocarbons, the kerosene in this case, we want to start by stabilizing the airway, which is our first priority. Yes, we want to ensure that the airway is clear. Then we want to give supplemental oxygen because these babies, we say they're going to present with respiratory distress. So we want the heart rate is so high, they have difficulties in breathing. So we want to give oxygen to help and to support them. Also, we want to do bedside pulse oximetry, like we want to monitor the pulse rate. So there's the machine that we monitor pulse, we call it pulse oximetry. So we want to monitor their pulse. So we want to do early intubation and also mechanical ventilation. Remember we talked about CPAP at some point in our previous episode. So CPAP is more it's more better compared to just giving oxygen alone, because here we want to monitor so many things. This is what we are calling a mechanical ventilation, and this you want to do if we have got severe respiratory distress or if there is reduced levels of consciousness. So we want to do we might find ourselves doing early intubation and also mechanical ventilation. Hope you're moving on well. We want another way of treating this kerosene poisoning. We want, of course, to remove these clothes, the contaminated clothes, and also we want to wash off the skin. Where if this clothes this child has, and this is where the kerosene poured on the clothes that they are wearing, we want to remove them, and also we want to wash the skin off. This is a way of preventing and avoiding more danger. So again, we want to take all precautions to minimize the patient's risk of vomiting. So we don't want these patients to vomit, those who have ingested the kerosene. And this is where people go wrong. Please remember that. Listen that no, don't do induction of vomiting. Most people will induce vomiting. They put hands inside the mouth. They want this baby to vomit so that the poison can come out. When it is kerosene or any hydrocarbons, like we mentioned all of them, in this case we are talking of kerosene, we should minimize all the chances of this child's vomiting. This I want to correct most people, because this is what people do. Because if we vomit, we have increased, we are going to get further aspirations. Another note is that gastric lavage or emptying increases the risk of aspiration again. This we said in our last video. We said all hydrocarbons, we don't do gastric lavage. We are saying again, it is going, when you make that child vomit, when you do the gastric emptying, so this poison is coming up to the lungs and we are causing aspirational pneumonia. We call it pneumonitis. So we don't want to reach there. So we don't want to induce vomiting. We don't want to do the gastric emptying or the gastric lavage. Now, patients with no aspiration, those with no aspirational pneumonitis, or they have no symptoms after 4 to 6 hours, can be discharged home. However, those with symptoms, we want to admit them. We want to have them for close monitoring. So we want to admit them, and mostly we want to treat by supporting, especially giving oxygen. Yeah, so we want to remain with these that have got severe respiratory distresses, they have aspirational pneumonias. We want to remain with them in hospitals for further management. So we might do a trial of another treatment we want to do is a trial with bronchodilators. Remember, the bronchodilators are the drugs we use to those people with asthma, the asthmatic patients, where it opens up the lungs. So this is in case the child, the child or the patient has got a wheeze. We know that this chest we have congested chest, so you might use the bronchodilators and we get rid of these bronchospasms. So other things, we can find antibiotics useful in case if there are secondary infections. Remember, we said infections will come as a result of these poisoning. Yes, so we might find ourselves giving antibiotics as part of management. So this is it about kerosene poisoning. You can imagine and you're able to tell how serious this is, and this is a kerosene that are used at home every day. So we said don't store the kerosene in those bottles. Those are soda bottles, because children will get enticed. Don't use the enticing bottles to store these things, because they'll get them and they ingest thinking it is something sweet. So first of all, you have to keep them out of reach of these children. Again, you keep them where they cannot reach them, again in bottles that they cannot even think that there's anything. So this is to the parents. It is a challenge to parents. Please be very careful with this. You can see the dangers that all this is causing if we are very careless, if we don't keep them or store them how they're supposed to be stored. So thank you so much. This, I saw it better to do the kerosene poisoning, because it is the most it is the common one in our setting. So hope now you know. Thank you so much for always keeping tuned. Please be watching these videos until the end. And if you have not subscribed again, I don't know, biggest part have not are watching, but they are not subscribing. Please subscribe to be part of us. Again, put on your notifications to know every time I'm posting a new video here. Yes, comment in the comment section in case you want any clarifications or you have any questions. Thank you for the questions that I'm getting. So I'm very happy, and this one keeps motivating me. So thank you so much. Share these videos widely so that many people can reach them. You don't know which people we are helping by doing these videos. So please kindly share them. My email is provided at the end of every video. Again, I said I have a number whereby if you have a personal question about your child, you want a consultation, I give the number here, the one you come direct to my DM. And of course, I said it is at a fee, guys, yes, so that we continue doing this job, so that it can keep motivating us. So thank you so much. Till next time. Bye bye.